Welcome to the Brilliant Board Review Podcast, your trusted source for high-yield board prep, CME, and the latest in clinical medicine.
Now let's talk about beta blockers after MI. Now, this may seem like heresy, as we know the great things that beta blockers do. We've talked about it, but are they needed after MIs? And a lot of the older studies were before all these great revascularization techniques that we have available to us now. We have more drugs and more things available to us. So are they still needed? And you say, well, why do we even care? Beta blockers are cheap. They've been around. Yeah, they've been around. But they also have side effects. Some include depression. Some people get hit with severe depression. Some people just feel they have the blahs, like they can't really do anything when they're on the beta blockers. Like it just makes them not want to do anything at all. And then if you give somebody erectile dysfunction, they're not going to be your friend. They're not going to want to come over your house and shake your hand. They're not going to be happy with that. And then you may have to chase it with another medication. So these are things to think about with beta blockers, is that they do have side effects, and we have to be mindful of that. Now, there's two studies. The first one is we're going to talk about is a Swedish study, and it's where beta blockers, metoprolol, bisoprolol, and so given no beta blockers or no beta blockers, metoprolol, bisoprolol, after MI and revascularization, the endpoint was death or recurrent MI, and the patients all received basically the normal. These had normal left ventricle ejection fraction. They're all on antiplatelet therapy. They all had statins, and they all were either on an ACE or an ARB. So they're taking a standard of care medications. And there really was no difference between the two groups. Now, this is a French study. Follow-up, these are both in the New England Journal. Now, this is previous MI and revascularization. So it's about, we'll say, 2.93 years after they had an MI and revascularization. Trying to figure out, should we get the beta blockers or stop them? So beta blockers or stop them. Now, the 3-year follow-up point was endpoints of death, MI, stroke, cardiovascular rate, hospitalization. It was lower in those who took a beta blocker. So who was excluded from this study was 3,700 people. It was in France. If they had heart failure reduced ejection fraction less than 40%, they're excluded from the second study. Or if they needed other indications for beta blockers, maybe they had sinus tachycardia without the beta blockers. So those were excluded. But those who continued the beta blockers had endpoints of lower death, MI, stroke, and cardiovascular-related hospitalization was lower. Now, the biggest lead in that was, and it was 21 versus 24%. The biggest thing was fewer hospitalizations in the beta blocker group, 17 versus 19%. So does this end the question, should we take beta blockers after MI? No, it still opens the discussion. There are several more trials that are coming up that will hopefully kind of get this tiebreaker. Should we continue or not continue? Or do we find specific groups that we should continue or not? Remember, both these patient groups had normal ejection fraction.
Thanks for listening. Visit brilliantcourses.com to learn more and claim credits for this educational activity. See you next time.